Hello everyone, I am Dr. Rajesh Vukkala, consultant physician at Medicover Hospitals, Begumpet. Today's topic of discussion is muscle cramps. It is a very frequenting occurrence nowadays that a lot of people are reporting muscle cramps. Now, muscle cramps can be, physiological and pathological. When I say that, it can be something which is temporary and sometimes it can be permanent as well. So when you look at the temporary causes of muscle cramps, the most important thing we get to know is how deconditioned you are when you are trying to do some kind of exercise or joining a gym and trying to do some weightlifting. So when you tend to do this, you tend to know that your muscles are not letting you do this. That is because you're not been accustomed to doing this. That is the first thing you should know. So the way to get over this is doing graded exercises so that the muscle tones up a bit more and the muscle strength develops over a period of time. That is the one of the important areas of where you have to concentrate. The other area we should look at is, are you dehydrated before doing any kind of task? Dehydration causes a lot of electrolyte disturbance, and this kind of electrolyte disturbance can play a role in terms of muscle contractions, particularly relating to sodium and calcium. So you have to make sure whenever you're up to doing a task like doing strenuous activity, you should probably make sure you're hydrated properly and also take adequate amount of calories to reach your target goal of doing that kind of activity. The other areas you look at is where there is an organ dysfunction. For example, the heart is one of the areas of concern. So when the heart functions are not appropriate, there is going to be a reduction in the supply of energies to different parts of the body. Particularly the large muscles in your body require a lot of circulation, lot of energy, lot of calories to be delivered. Along with that, they also need nutrients for the muscles to contract and function. So when the heart is weakened, when the heart is not able to cope up the demands, you tend to present with muscle cramps, mostly in large muscles of the body. And also when somebody has got long-standing diabetes, which is poorly under control, a lot of them presents with muscle aches, and this is because of higher sugar levels that is there in the body. When the higher levels of sugar is there, it hampers the spread of energy or dissipation of energy to the muscles, and also it also impacts the functioning of the nervous system in this particular people. So that can result in a lot of muscle aches and cramping. People who have got severe blood loss, either in the form of nutritional form, or if there is a frank blood loss where a young menstruating woman do develop anemia, they tend to have a lot of muscle cramps as well, particularly in the night time. So all this culminates into creating muscle cramps and nocturnal cramping. Sometimes in the medical terms we call this as restless leg syndrome. There are different conditions which can cause restless leg syndrome. Most common presentation of restless leg syndrome is tightness in the calf muscles, tenderness in the leg muscles, and when somebody tends to move it or massage it, people tend to get relief immediately. These are directly related to where there is a chronic kidney condition, chronic heart condition, diabetes, chronic anemia, and chronic deficiency of vitamin D. All this culminates into creating muscle cramps in the body. So if you were to really look at muscle cramps, you have to properly assess, investigate, and probably address the abnormalities that are found, which can actually easily cure this muscle cramps in the long term to come. Thank you.